prone, supine, or side posture. The prone position is the most commonly used. In this position, we apply contacts over the transverse processes of the thoracic vertebra and apply pressure directly on that fulcrum. The patient is then asked to take in a deep breath, and as they exhale, we apply pressure to slightly bellow the air out of the patient. At the end range, a slight impulse is then applied. Lower thoracic manipulations may require the patient to be placed in a side posture position. By applying counterforce to the vertebra above the functional lesion, the motion segment can be better isolated. Slight distraction can be applied by asking the patient to shrug the shoulders as the manipulation is administered through a hooked finger contact at the vertebra below. Another common thoracic spine manipulation is performed in a flexion position. The cupped hand is placed over the spinous processes, and the patient is asked to take in a deep breath. As the breath is expelled, the patient is lowered to the examination table, and a high velocity, low amplitude impulse is then applied.